Hello and welcome back to Insightsias. The plight surrounding the spread of COVID-19 or the novel coronavirus does not seem to come to an end. It has already created a chaos and panic among the people across the world. With more than 4,000 people killed and nearly 1 lakh people infected, the World Health Organization has already declared it to be a pandemic. This is at the international level. But at the state level, various states in India, including Assam, Karnataka and Delhi, have shut down schools, colleges, gardens and even shopping malls. And further, to better equip the states to fight against the spread of this disease, it has been already declared as a notified disaster. When any disease is declared as a notified disaster, it allows the states to withdraw funds from the State Disaster Response Fund. Maybe even this was not enough. So, all states and union territories have now been directed to invoke provisions of Section 2 of the Epidemic Diseases Act of 1897. When this section is enforced or invoked, the advisories of Health Ministry become enforceable. So, in today's lazy lesson, our focus will be on the Epidemic Diseases Act, its key provisions, its significance, and what are the criticisms surrounding. First question we have is, what is the Epidemic Diseases Act of 1897? See, it is routinely enforced across the country for dealing with outbreaks of diseases such as swine flu, dengue and cholera. This law, which is nearly 100 years old, was introduced by the British colonial government to tackle the epidemic of plague that had spread in the erstwhile Bombay Presidency. The main objective or aim of this act is to provide for better prevention of the spread of dangerous epidemic diseases. Here, epidemic refers to an increase often sudden in the number of cases of a disease above what is normally expected in that population in that area. These epidemics occur when an agent and susceptible hosts are present in adequate numbers and the agent can be effectively conveyed from a source to the susceptible hosts. And an epidemic may result from a recent increase in amount or virulence of the agent, the recent introduction of the agent into a setting where it has not been before, or an enhanced mode of transmission so that more susceptible persons are exposed, or a change in the susceptibility of the host response to the agent, and or factors that increase host exposure or involve introduction through the new portals of entry. So mainly what this law does is, it provides special powers that are required for the implementation of containment measures to control the spread of the disease. But what are these powers? See, Section 2 of the Act says it empowers the state governments or union territories to take special measures and formulate regulations to contain any outbreak. The section says, when at any time the state government is satisfied that the state or any part thereof is visited by or threatened with an outbreak of any dangerous epidemic disease, the state government, if it thinks that the ordinary provisions of the law for the time being in force are insufficient for the purpose, may take or require or empower any person to take such measures and, by public notice, prescribe such temporary regulations to be observed by the public or by any person or class of persons as it shall deem necessary to prevent the outbreak of such disease or the spread thereof. And it may also determine in what manner by whom any expenses incurred shall be defrayed. And further, the same section, that is Section 2 of the Act, says, in particular and without any prejudice to the generality of the foregoing provisions, the state government may take measures and prescribe regulations for the inspection of persons travelling by railway or otherwise, and the segregation in hospital, temporary accommodation or otherwise of persons suspected by the inspecting officer of being infected with any such disease. And Section 3 of this Act empowers the state government to impose penalty on any person disobeying any regulation or order made under this Act. And more importantly, Section 4 of this Act protects persons acting under this Act. It says, no legal proceedings shall lie against any person for anything done or in good faith intended to be done under this Act. But because of its potential for abuse, this Act has always been criticized by the historians. In 1890s, when this Act was enacted, using powers conferred by this Act, colonial authorities would search suspected plague cases in homes and among passengers with forcible segregations, evacuations and demolitions of infected places. So this is the main reason behind the criticism of this Act. And surprisingly, under the provisions of this Act, freedom fighter Bal Gangadhar Tilak was jailed. And in last one decade, this act has been invoked 3 times. That is, first time in 2009, next in 2015, and next in 2018. In 2009, it was invoked to tackle the spread of swine flu in Pune, and next in 2015 to deal with malaria and dengue in Chandigarh. And in 2018, it was invoked to tackle the cholera. But despite its potential for abuse, why do we still need this act? See, firstly, though it is a colonial law, we still need this act. Why? Because it enables prevention of the spread of dangerous epidemic diseases. And besides Epidemic Diseases Act, we have many other relevant laws which were enacted by the British in the colonial times. These include IPC, CRPC, Census, and even the Famine Act. So, if the government thinks these laws are good enough to fit in the existing circumstances, then there is nothing wrong in utilizing these laws. And even Subhas Kashyap, who is a constitution expert and former Secretary General of the Lok Sabha, says there is nothing wrong if the government is willing to implement a colonial era law, as it still exists in the statute, and maybe the governments over the time did not see the necessity to amend the act. So, despite the manner and time in which this act was enacted, the act is still relevant today.